Dr. Pemmaraju, let's talk about biomarker testing. Can you help us understand what biomarkers are and how they may affect treatments?
Yes, biomarkers, I think that word gets mentioned a lot with really no definition because it's one of those words that can be whatever someone wants it to be. So you're right. For us, it's a very important word in MPN. Bio meaning, of life, scientific, and then marker meaning some kind of a measuring stick that has a value. Well, there's two ways to look at biomarkers. One is the obvious, which is we have the defined big three molecular mutations. So that's JAK2 V617F, followed by CALR mutation, followed by MPL or MPL. Those are the big three. Those make up about 90% of all patients with MPNs. You're technically not born with them, although new data suggests that you may acquire these mutations, right after birth. So those markers are important because they can be used to diagnose the disease, right? Particularly in the challenging patient, they have high platelets. You can't tell if it's reactive or ET. So they're helpful at diagnosis. Maybe some studies have shown that some of these markers can be predictive, Catherine, of blood clots. Let that research be ongoing. And then, obviously some of these may be helpful in terms of designing the future treatments, particularly targeted therapies. So I think biomarkers are part of our field, if you look at it that way, at diagnosis and risk stratification prognosis. But there are other factors that are starting to come out. One is there are molecular mutations outside of these big three. So outside of JAK2, CALR, and MPL that are very important, actually, and not everyone's checking for them. There are ASXL1 mutations, EZH2, IDH1 and 2, so on and so forth. So these are extended molecular markers that can be checked at some doctor's offices that now in the latest scoring systems, if you have one of those or more than one or two, they can elevate your risk score. So if you have low risk or intermediate risk myelofibrosis, they may make you intermediate or higher risk. So that may be a bit more complicated than what most people are aware of. But just so you know, there are markers that can be readily checked that can tell if your disease may be a bit higher risk than we thought, say, 10 years ago. I think other biomarkers that we look at are some of the labs that are just the regular labs that are on almost every panel, but they can tell a lot about the disease. There's the LDH, lactate dehydrogenase. There's, several markers such as CRP and SED rate. So anyway, there's a lot of labs that we can check depending on where you are in your disease state that can kind of tell us a lot about how inflamed you are, right? How active your disease is at the moment. And then that will lead to further confirmatory tests. So I think, yeah, in general, this is an active developing area of research in our MPN field.